All right. Welcome, everybody. We have two special guests today. This is our first episode where we've had two guests, but I thought it was really important. And this is a interesting podcast because I will probably be doing very little of the top talking because this is not a topic that I am an expert at. So we have brought two experts in on all things pregnancy, fitness, pain, injury, and everything that a woman who is pregnant or wants to get pregnant would want to know, and as well as postpartum, especially. We're going to talk a lot about fitness. So today our guests are Kerrie Audie. Kerrie is the owner of Pearl Street Fitness. She is a postpartum corrective exercise specialist. She is an instructor at the Bar Standard. She is a pre and postnatal, oh, I'm messing this one up. Kerrie, help me out.
Trainer.
Trainer, and also a mother of three. And one other thing that I will say about Kerrie, and I know a lot of women who go out there and they see these women who have these giant bellies, and then about 4 months later they have these six-pack abs, get really angry. And Kerrie's one of those people you can get angry at because she has done, if you follow her on Instagram, you kind of have seen her progression. And Kerrie, that was amazing. Like everything that you did and how fast you got your body back, just six-pack and everything else. Very impressive. Um,
I
so
will. I think she kept her six pack even while she was pregnant. I don't think she ever got
absolutely,
rid of
absolutely, yeah. Um, so we will talk about how you do that, not only for yourself but for your clients as well, because I know a lot of people will want to know that. Also, as a guest today, we have Dr. Courtney Giesman. Courtney is the director of the Women's Health Division of Kinetic Chain Denver Physical Therapy and in the Women's Health and Pelvic Floor Rehab. Welcome, Courtney.
Thank you.
All right.
Good job, Jamie.
Oh, thank you. I had a lot to memorize there. I got
Numbers
most
off.
of it. I got
Yeah.
most of it. All right. Um, so let's start off with misconceptions, myths, and what are some misconceptions about pregnancy and fitness that you'd like to address?
Yeah, I love this topic. I think there's this like feeling of like fragility around a pregnant woman sometimes, when really it's like the strongest that you'll be in your adult female life. You think about you're growing not just a baby, you're growing another organ. So your body's doing so much on its own, and supporting that with fitness and health is, paramount to having a great journey. So some of the myths that are somewhat outdated and can still be given as like advice from, people that have been pregnant in the past, even doctors will say like, you can only get your heart rate up to a certain threshold while you're pregnant. And the best part about our bodies is that our bodies keep us safe. Like you're going to pass out before something happens while you're working out. And the same thing's true while you're pregnant. Like you'll pass out before anything happens to your baby. So getting your heart rate up is actually excellent training for labor and delivery, because your heart rate spikes naturally with your
Yeah.
contractions, and your baby needs to get used to that kind of stress. So getting your heart rate up in a safe and controlled environment like an exercise class or an exercise program is a great way to train your baby for labor and delivery. So mimicking that labor and delivery journey of like spiking your heart
Up
rate
and downs, yeah.
and then bringing it back down with control, and then spiking it again and bringing it back down with control, is so good for both you and your baby.
Yes.
Um,
What are some of the benefits of exercise throughout pregnancy? I have to imagine there's several for the mother and there's probably several for the baby as well.
Yeah, the list is endless. A good rule of thumb is like whatever you were doing prior to getting pregnant, you can continue to do. So if you were a cyclist or you loved spin class, like go for it as long as you can maintain proper posture, and regulate the pressure within your core. We can get to that later. But if you enjoyed HIIT classes, running, like you can continue to do that as long as you feel good doing it. And then the benefits are, you can minimize the risk of gestational diabetes, and your blood capacity expands greatly while you're pregnant. So taking advantage of that cardiovascular expansion is a great way to train yourself to have more endurance
Hmm.
after pregnancy and beyond. So getting that fitness level up a little higher while you're pregnant is totally possible, which is, kind
Interesting.
of exciting.
Yeah.
And then other benefits are, like your baby will have a great environment to grow in and thrive in. So you can minimize having like an overly large baby, an underweight baby. So you'll have like, nice, fit, healthy environment for your baby to grow in. And then benefits for mom are like you'll have more energy, you'll maintain that muscular strength that you need to recover postpartum, carry a baby around. Like we forget that you're carrying around this weight that just continues to grow. So you're constantly in progressive overload carrying this baby that continues to grow. So staying
Yeah.
strong
Never thought
during
about it that way.
pregnancy is awesome.
Yeah, I
I
never thought
think
about that. That's
too,
interesting.
I think piggybacking off of Kerrie too, and this is kind of another myth, is that I think a lot of people, just assume, okay, after I have baby, I'm going to have to give up everything that I was doing. Like if I was mountain biking before, or if I was taking HIIT classes before or doing yoga, that's all over. And I can't return to my favorite activity or sport or whatever it is. And of course, you want to always talk to your doctor. You definitely don't want to go out of the gate right away, and you want to make sure that you're cleared and everything like that. But as far as getting back to the activities that you know and you love and you were doing before, or even doing throughout your pregnancy, is 100% doable. And I think some people just assume they don't even give it a chance, and they just assume, oh, if I was doing this activity, I know that I'm never going to be able to return to it again. And I think that that's
Right.
definitely a big myth.
Yeah. I mean, the hardest part about that is finding the time. But other than that,
Yeah.
like
Yeah.
it's definitely doable for sure.
You
Are
do
there
it well, Kerrie.
are there any exercises that women should avoid during pregnancy?
100%. Yeah. Thanks for bringing that up. So the biggest thing that you want to have control over is the pressure within your core. So if you go back to just basic core function, your diaphragm and your pelvic floor need to work together. And your belly is already expanding outward. So maintaining that pressure in a safe way to mitigate the amount of pressure that comes outward along that connective tissue between your abs is super important. So any exercise that does not allow you to regulate that pressure is one that you should avoid. And this goes back to another pregnancy myth. Like some movements are fine for some women and some movements are not fine for some women. So like if I use myself as an example, I was able to do a full plank pretty much right up until I delivered because I was able to maintain that core connection. But some women have to stop doing full plank at 20 weeks.
Hmm.
And then another myth is like, oh, pregnant women cannot be on their back. And that's a very day-to-day situation. It's not like a mark at, oh, once you hit 100 days pregnant, you can't be on your back anymore. And the reason that they say not to is because baby can press down on the vena cava, which can like make your heart rate slow down, which would affect baby's heart rate too. So that's really just dependent on baby's positioning that day and things like that, and where baby's laying within your belly.
Sure.
So you might be fine on your back one day and then not fine on your back another day. So it's very day to day and very specific to the woman at hand. But to make the answer shorter, you should eliminate crunches because they serve no purpose while you're pregnant. There's no reason to strengthen your six-pack abs while you're pregnant because they need to stretch. So teaching them to stay short with crunches is just going to make it harder for you to regulate that pressure in between.
Yeah, that makes sense. So what I heard you say, it's very individual, and not only is what you can and can't do individual, it's day to day.
Yes,
Okay.
100%. Yeah.
Yeah. So kind of a gray area, in other words. So there is no black and white. But if I was a pregnant woman, what I would take out of that is great. Now I can probably do more than what I read on the internet says. At 100 days you can do this. At 200 days you have to stop doing this. So I think getting with somebody like yourself who actually knows these things and has taken other women and who has gone through these things could be very beneficial. Now, a couple times you mentioned the pelvic floor. Um, what happens to the pelvic floor with pregnancy and then also with aging? So as you've now had, I don't know how far apart your kids are, but you've had three different kids now, and you've aged as time. So what happens both to the pelvic floor with pregnancy and with aging? Is there different things you should do at different ages as far as fitness?
So I don't think it's really anything to do with age as much as it is like successive
Mm,
pregnancies.
okay.
So your pelvic floor takes on a huge role when you're pregnant. It's holding all of a sudden more weight. Your center of gravity changes, so it's dealing with that. You have postural changes, so it's dealing with that. And then your pelvic floor has to stretch like immensely, and then come back together. So it does a lot more than we realize. It's not really something that we think about on a day-to-day basis, but it's basically the can't like I like to describe it as a hammock within your pelvis that holds up a lot of your organs, but it also assists you in getting baby out, unless you have a C-section, and pelvic floor is just doing the work while you're pregnant. So that's another myth that like if you have a C-section then your pelvic floor is okay, but it still did a lot of work to hold that baby weight while you were growing.
Sure.
So you still need to think about it in your recovery.
Yeah, that makes sense.
So that constant like pressure that you put on it while you're pregnant and then again giving birth and then recovering and then doing it again is more so I think what you need to think about rather than like how old you are. Um, but age does play a role in how you recover, of course, because as you get older, it's harder and your regenerative cells like slow down and all that stuff. So that's something to consider for sure. But basically, you want to train your pelvic floor to come back to the state that it was in before you were pregnant. So training it while you're pregnant to both lengthen and contract is super important. And you do that with your breath. It does it all by itself regularly, but training it under a load, like in your squat or while you're running, is super important so that it has that reflexive strength again.
Okay. All right. Um,
That
and I
makes,
I
know,
was
yeah, I feel
go
like
ahead.
Courtney could expand on that a little bit too.
yeah. So I was just going to add to that. I think kind of another myth and some things that I hear, patients saying too, especially if they're just on YouTube or hearing from other friends, is like the good old fashioned Kegel. It's like there's good and bad with it, and I think that a lot of women, they know about it, they hear about it, and they just assume that that is like the one and only thing to do to recover as far as like pelvic floor goes, when half the time when you really dive into it, half the time patients don't even really necessarily know like what the Kegel is doing, what the purpose of it is. Some of them don't know how to do it, or if they are doing it correctly, it doesn't necessarily mean that they're doing it in the corrective exercise or the corrective posture for them, because some women could easily be able to do a Kegel in a squat, or could be learn quick to do a Kegel while they're running, while others might need a much longer time to be able to maybe just start in hook lying on their back, or maybe in sitting. And then typically, I think where kind of there's a little bit of fault too is a lot of times I think, not kind of getting the appropriate feedback from people too, of knowing how to do a Kegel. Most just kind of will use like the more quick stretch response is kind of how we refer to it. So I kind of call it like bobbing for apples, like when you were a kid and you just kept going down and up and down and up really quickly. And that really is not necessarily going to be beneficial in any way to actually strengthen the pelvic floor. So I think it's a big myth for people to just tell women you're fine if you just go do a Kegel, because it's such a gray area of do they know how to do it? Do they know what it is and what the purpose of it is? Can they do it in multiple positions? And so that can be, from a provider standpoint, can be kind of frustrating, because I think it's just in general out there in the tabloids and online and all that stuff, it's just Kegel, Kegel, Kegel.
Mhm.
And no one really knows the background behind it.
100%. And I think the disconnect there is that they're not taught to then lengthen. So Kegel is just only about contracting in terms of like how it's presented in,
Hmm.
like you said, the mainstream. It's just like, oh, just tighten up, tighten up, tighten up. But that's kind of like doing a bicep curl only at the top half over and
Sure.
over and over. And if you
Hmm.
don't fully release that muscle to then contract it again, it's never going to get stronger and it's never going to be functional. So you have to learn how to also lengthen it and relax it and release it. Which, yes, good point. And I think a big cue people hear for Kegel is like stop the flow of urine, or like hold your pee. And that really only contracts the front part of your pelvic floor and it leaves the whole rest of it out. And it's a full circle. So, like, just only contracting, if you think about it like a clock, only contracting 12 o'clock, you're leaving behind a whole mess that's not getting any work. So, yeah, that biofeedback that you can get from like a pelvic floor physical therapist is huge and should be 100% part of your postpartum journey.
Yeah. All right. So, since you brought it up, kind of like with the cue of just stop your urine, I know both during pregnancy as well as postpartum, many times there are some issues, bladder issues,
Mhm.
and there can be problems with leaking. And I think I didn't know quite how prevalent this was, but it's actually, I heard a podcast a couple years ago, and it was like a CrossFit podcast, and there was two ladies, and they were talking about, peeing their pants a little bit when they do double unders, there was this big joke about kind of, oh, that's just normal, and I think every physical therapist and Kerrie trainer like you was just like, oh my god, that's not normal, and we all kind of recoiled in horror. And I think there's a difference between what's common and what's normal. And I think it's probably a very important message to get out there that these what is common versus what is normal. So let's talk about that a little bit. So what are some of the things either during pregnancy or post pregnancy that can be changed and fixed that women don't have to just live with?
I love that you said that it's common but not normal because it is super common to leak a little bit, whether you've had a baby or not. And that's a huge sign of just pelvic floor dysfunction in general.
Mm-hmm.
Um, and it's fixable in lots of ways. I think the main thing that you need to work on is your breath and making sure that your diaphragm and your pelvic floor function together to, again, minimize that. Pressure dysregulation in your core. So if a lot of pressure is going down to your pelvic floor constantly, you're going to deal with some pelvic floor issues. And it could be prolapse, it could be an overworked pelvic floor. And leaking can be a sign of either a weak pelvic floor or an overactive pelvic
Mm.
floor. So if you're holding your pelvic floor too tight all the time and it's not getting that chance to lengthen, it's kind of like just constantly holding that bicep curl again. And then
Sure.
like it's gonna fatigue in a way that's not, and it's not
Mm.
functional. It's not getting stronger. So it's like fatigued in a way that like, I'm so tight right now, I can't tighten up anymore to hold this urine in for you.
Gotcha.
So I have to lengthen so that I can learn how to, again, deal with this pressure. So the number one thing that you need to work on is your breath and make sure that your breath is functional and it's regulated and that your diaphragm and your pelvic floor are working together. And then the other thing to focus on, like especially specific to a double under, is your posture while you're doing that double under. Like, is your diaphragm stacked over your pelvis in a way that you can minimize that pressure? Or are you flaring your ribs and leaning back and like breaking that core canister?
Mm.
So there's a lot of things to focus on for sure. That's a super lengthy answer, especially depending on the person that you're talking to.
Mm-hmm.
But getting into a pelvic floor physical therapist to find out if you are in fact weak or overactive is definitely the number one place to start. Because if you're weak, then Kegels will make sense for you. But if you're overactive, Kegels are a no-no.
Sure. Courtney Kerrie kind of set you up for this one. So since you mentioned the pelvic floor physical therapy, why don't you jump in and kind of just give us kind of your thoughts on that as well?
Yeah, I definitely agree a lot with what Kerrie was saying. And I love the fact too that she mentioned, because I hear this a lot from patients as well. As far as pelvic floor therapy goes, you do not have to have a baby. That doesn't have to be the only reason to come to pelvic floor therapy. So even just normal like just regular leakage doesn't necessarily mean, again, that that's normal. It can be common. It doesn't mean that it's normal at all. And so you can certainly come to pelvic floor therapy whether you've had a child or not, any age, shape, or form. You should not have to deal with constant leakage, especially if you're experiencing it during a workout. And it is very frustrating from a provider standpoint to hear when people say that it is normal, or it's just like, oh yeah, girl, just, just wear a pad and it's fine. Like that's, and it's like, we need to really get away from diminishing this and making women feel like, instead of actually seeking out extra help, seeking out a physical therapist or someone like Kerrie, who you can learn how to tighten up the core and either relax those muscles or strengthen and lengthen those muscles. Instead, we're just throwing, it's kind of like in the medical profession, just throwing pills at a patient or surgery when there's other options. It's like, no, you shouldn't have to just wear a pad or just double your underwear or just, not do double unders and take them out of your workout. There are other options out there that are known to work. And unfortunately, there's just, I feel in general in this field, it's just not only just a lack of education that's present to the public, but it's also just comes from this people who just assume that there's a normalcy, because that's what it is in our culture. It's just all these things are just supposed to be normal for women. And so this is how we grow up, and this is in tune. We keep replaying this in our heads, and until we actually believe it, that, oh, what I'm going through, every other woman is going through, and it's fine, and we just have to deal with it for the rest of our lives. And that is not true in any way, shape, or form.
So, Courtney, let me push back a little bit, because in my head I can already kind of see some questions about some of what you just said. So, question number one is any amount of leaking normal? And then question number two is if that is normal, when do they know when to take action, or like at what point is it appropriate to start trying to work on this?
Of course, yeah. I think this is kind of where it gets into the gray area. I think it depends, because you have to kind of figure out who the person is, what's going on, what are other symptoms underlying it, and what kind of leakage that there is, because is a couple different types of leakage, and to know kind of when it's happening and kind of what's going on with that. But the biggest thing I would say too is that if it's starting to affect your daily life in any way, like if you're having to, for example, when you're working out, if you're modifying your workouts, or you're completely getting rid of an exercise because of it, or even just the sheer fact that you're embarrassed, like you have to put extra pads in your purse or wear 2 pairs of underwear or something like that, that's a definite problem. And I would say that is not normal in any way. That should not be normal. I know some women kind of probably get in the habit of telling themselves that it is, but if it's affecting your daily life to that point, that magnitude, there's something going on that needs to be looked at. But in terms of leakage wise, and the pelvic floor, you really shouldn't have much leakage when you're doing workouts or laughing or anything like that. And so if you recognize that, and if it's something that's happening consistently as well, then again, it's something that's definitely going to need to be checked out, just to figure out as well, again, since there's different types, kind of what kind of leakage is going on, when are you having it, what activities are causing it,
Sure.
and if it's progressively getting worse over time as well.
Now you said there shouldn't be much. Is there a clinical? Because to me, much, it says a little, but it doesn't really say how much. What is not much?
So I would say you shouldn't have leakage.
Okay,
if your pelvic floor is intact, and like Kerrie said, as far as diaphragmatic breathing goes, you shouldn't be just leaking at random times throughout the day.
gotcha.
Granted, I understand that that's different as far as after pregnancy goes, but again, that's not necessarily, that's common, but it's not necessarily normal. And it's something that you should go in and you should get checked out to figure out, again, is it because of tightness? Is it because of weakness? And so on and so forth.
So Kerrie, is some of this preventable? Like, let's say somebody started working with you on some of these things before, with the fitness, before this ever became a problem. Is some of this preventable? Like, to so that we could almost eliminate that problem?
It's definitely preventable. It's also like it doesn't, like we talked about, it doesn't have to be just because you're pregnant. It could be a postural thing that
Right.
like
Yeah.
over time you've affected your posture in a way that your diaphragm and your pelvic region aren't working together anymore. So it's going to take a little bit more work to get back to that baseline level. But it's definitely preventable. If you have that connection to your pelvic floor where you can feel it relax and you can feel it contract, then you'll know like, oh, I'm about to sneeze. Let me contract my pelvic floor so I can control that pressure so I don't leak while I sneeze. Or I'm about to cough or laugh or whatever it is. You want that to be reflexive. So you want your pelvic floor to automatically turn on. But if you can start with making that connection, then you can train that reflexivity for sure. Um, that reflexive part of the muscle. I think I just made up a word there.
Sounded good.
It works. And then it's also never too late to start healing. So like sometimes I hear like, oh, I had a baby 10 years ago and I still leak. So it's just part of my life. And like, it doesn't have to be. You
Sure.
can start working on it at any point. It's never too early and it's never too late to start retraining that muscle the same way, like all of a sudden you decide I want to be fit, you start working on it. It's like I want to stop leaking, you start working on it. It's never too late.
Okay. Now, earlier you had mentioned the canister, and the canister was for me was one of the things that I thought was the most interesting and visually kind of just put every picture, like put everything together for me. So let's talk about that because I think if people can kind of get the idea of what the canister is, which muscles are working there, how everything works together, kind of paints a picture of how they can improve these things. So can you describe the canister, which muscles are involved, how they all work together just a little bit?
Sure, that's my favorite part of what I do. So the canister is your torso, basically. So like from your rib cage to your hip bones is a good visual point for you to think about. And the muscles within your rib cage are your diaphragm. I think it's a common misconception that your diaphragm is actually a muscle, and it's your breathing muscle. So training that is super important. And it's also the same shape as your pelvic floor. So they work together and they should stay stacked pretty much over one another. So that's the top of your canister is your diaphragm and the bottom of your canister is the pelvic floor. And then within that canister, you have all of your abdominal muscles and then the muscles of your back that keep your spine upright, stuff like that. So you have your six-pack abs, which are your most superficial layer of muscles, your rectus abdominis, and then your deepest set of muscles, your transverse abdominis, which wrap around that canister pretty much in a 360-degree way. And then within there, you have your external obliques, your internal obliques, your paraspinals, the multifidus muscles. Without getting nitty gritty with it, all of your core muscles are part of that canister. So the way that the pressure regulation works is when you take an inhale, your diaphragm travels down as your pelvic floor relaxes and expands. And then when you exhale, your pelvic floor contracts and your diaphragm travels back up to where it should go. And then the middle of the canister, your transverse abdominis will also expand with your inhale and then come in with you when you exhale. So if you can picture that, it's kind of like a jellyfish moving. So the jellyfish travels down as you inhale and then comes back up as you exhale. Or you can think of a balloon blowing up in a 360-degree manner as you inhale, and then as you exhale, it comes back down to a smaller size, which is kind of like reverse of what you think, because when you blow up a balloon, you're exhaling. So it's a little bit of backwards way to visualize it, but I think it helps because you can say like, all right, that balloon in your belly needs to expand all the way around and all the way down when you inhale, and then needs to come back in and up when you exhale. So one of my favorite breath cues is inhale down and out, exhale up and in.
That was a great job explaining that. Obviously, you've done that a lot before. That was fantastic.
Oh,
Okay, so I know people will have questions because you've mentioned how you train the breathing and how that works in with the pelvic floor, but I know people will kind of want a little bit more from you. So what? So how do you? So just tell us a little bit more about how you train these muscles and exercise and like how, let's say, what would a session look like with you? And I know that's a general question, but what would a session look like with you?
So I always talk them first, like, what's going on in your body? What are your goals? All of that stuff. So simple questions of like, are you leaking? Are you not? If, if I asked you to do a pelvic floor contraction, would you know how? And then we go from there. So then I just watch them breathe. I'm like, okay, take a deep breath for me. And more often than not, their shoulders travel up towards their ears. So that shows me that their diaphragm is in fact not traveling down. And we got to work on just a breath pattern in general and retraining that breath pattern. As a society, we're very shallow breathers. We take a deep breath and it all comes up instead of going down and out like it should. So we start there. And then I start to check on that breathing pattern in different positions. So in a tabletop position, so on hands and knees. And then can you do a bird dog and keep that pressure canister intact? Can you extend an arm and a leg without changing the shape of your back? Do you know the difference between engaging your transverse abdominals versus just bracing your core, which is a very different
Hmm.
thing. So I think, especially women that come from the CrossFit industry and that side of fitness, bracing is a very big tool that they use. And bracing does regulate the pressure in your canister and protects your spine, but it's not a super functional way to engage your core. And there's
Because they're
times where
squeezing so hard.
bracing,
Because
sorry.
because they're bracing so hard, and it's kind of hard to do other movements.
Yeah. So like if I just told you to brace your core for a punch right now,
Yeah.
and can you take a deep breath
Right.
at the same time? No, you
Yeah.
can't. So if you fully engage your core in a functional way from the bottom up, you can still talk and have a conversation and maintain that contraction in your core and like go about doing some other things with your body, which is cool.
Right.
So I teach the difference between bracing and engaging. And then we just keep working on that breath movement within movement patterns. So like, can you do a squat and inhale as you travel down and then exhale as you contract and lift up out of that squat? And then you can actually feel your pelvic floor working and you can start to connect into the difference of like lengthening and contracting. So a typical section with me would start with breath work. We would move through some actual exercises. You're not just breathing. I'll promise I'll get your heart rate up and get you stronger. But it will always be functional and catered to the individual. So if you have to work on lengthening your pelvic floor, we'll be working on that. And if you have to work on tightening things up, we'll be working on that.
And I have to imagine the difference between bracing and engaging only gets more important the bigger you get throughout pregnancy as internal pressures and internal sizes and the way you have to move changes.
Yes, 100%. So like we talked about earlier, your six packs abs are basically what you're bracing. You're bracing your superficial muscles. You're bracing your paraspinals and your six pack abs usually when you brace. Because you just think like, tighten up and like trap that air. And when you engage, you're bringing that air out so that you can fully take another big deep breath in. And as you get bigger, that pressure outward along that midline, it's super important to regulate. So if you can connect in and engage your transverse abs, you can actually hug your baby up and in, make your bump smaller and bring your belly button up. Then you can learn how to really engage that transverse ab. So while you're pregnant is a great way to actually connect into that muscle group because you have such an awesome visual to watch it happen.
Cool.
Kerrie,
Great.
I'll just say too, because I've seen you do it with videos, you are so fantastic at not only explaining it, but describing it every single time you're doing some type of movement, whether it be like the simplest of exercise or you're going through squats or something like that. You are so conscious about the breath work of it. And I love how you tailor that in with everything because a lot of people in general don't even realize just how simple what breath work can add to their body, let alone women, especially after pregnancy and how important it is. So I think you do a fantastic job of it.
Thank you. Thanks, Courtney.
All right.
Anytime.
So we've talked a lot. So hopefully everybody can now see the benefits of strengthening, of working on breath work, building the pelvic floor um, during pregnancy, pre-pregnancy. Let's talk a little bit about postpartum issues. So, when is it safe to return to exercise after pregnancy?
So the general rule of thumb in like the medical field is 6 weeks, and that magic number is tied to stitches, and that's it. So typically, if you tear after giving birth, you have stitches, and stitches dissolve within 6 weeks. So that's why you have a 6 week checkup. There's absolutely no other reason that it's 6 weeks. So
Okay.
that is like the baseline, and that's like the minimal amount of time that you should take. um, Another thing to keep in mind is that like that organ that you grew to help grow your baby, your placenta, leaves a dinner plate size wound inside of you, which is, it's a pretty powerful visual. So you need to heal that too. So the general rule of thumb is that you're no longer bleeding, you're no longer in pain, and you're feeling like it would feel good to move your body in a new way again. So um, resting is super important. Your blood volume doesn't return back to normal until 8 weeks,
Jeez.
which is not talked about often.
Yeah.
Um, and it also is very dependent on the type of birth and labor and delivery that you experienced. C-sections can
Yep.
take a little longer to heal from. Vaginal births can take a long time to heal from, depending on if you did tear, how severe that tear was, if there were complications. There's a whole host of things that need to be considered, but the very minimal amount of time is 6 weeks.
All right.
I'll say too, just from a physical therapist standpoint, a lot of this is going to be dependent, kind of like Kerrie said, on the birth and the woman and everything like that. But there are definitely certain exercises that you should wait a little bit longer. And in general, you would not want to just directly the day that you're cleared from the doctor or you feel better, just go do. So for example, some of those, especially like as far as like making sure you can train the pelvic floor and your diaphragm as well, like doing heavy, crazy amounts of heavy lifting right away are not going to be good. And a big one is running, because we have a lot of runners, and runners love to run. They like, even women will still run like all the way up until they give birth. And it's going to be dependent, but typically you actually want to wait a couple months. You really want to make sure that you've dialed that pelvic floor in. And then also, just from an orthopedic standpoint, aside from the pelvic floor going through lots of changes, the rest of your body is too. Your hips, your SI joint, your back, all the muscles surrounding your upper thighs, your adductors, abductors, everything like that can get really tight or weaker as well. And so before you go out and do these heavier activities, you're definitely gonna want to make sure that you're cleared in that sense, and that you can not only make sure your pelvic floor is okay, but that the rest of the musculature and your posture has returned as well, or else you could cause other injuries.
Okay. And so, Courtney, I think I've read a statistic, and correct me if I'm wrong, that something like 80% of women have SI pain, low back pain with pregnancy, and they could benefit from physical therapy. And that may or may not be kind of pelvic floor. It may be more orthopedic, outside, kind of work in the joints and muscles. Um, and so
Mhm.
when I've talked with OBs, they have, or OBGYNs, they have told me that essentially 100% of women would benefit from a pelvic floor therapist working with them after rehab. So they don't really give any timelines on that, and you've kind of told us why they need to be able to do certain things. Let's can you make it easier for somebody to try to like know when to let's we've kind of talked about when to return to fitness, when to use somebody like yourself to help speed up the process of getting back into an active lifestyle.
Of course, yeah. Again, it's gray area. It's going to be dependent. I hate saying that. But similar to what Kerrie was talking about, usually as far as pelvic floor therapy, 6 weeks, just because you do want to make sure all the bleeding has ceased. If there were stitches or things like that tearing, we definitely don't want to be doing internal exams when all that stuff is still trying to heal, or say there was like, it could be an infection or something like that. We always just want to make sure that that area is cleared first. But then, yeah, as far as kind of the outlier stuff, so say like whether it's SI, hip, back pain, there's still some other minimal things that can be done prior to coming into pelvic floor and actually digging into the internal stuff. And we talked about it a lot, but something very simple and basic is just diaphragmatic breathing, working on breathing, things like that that can kind of start to heal up and work your way into pelvic floor therapy. But for the most part, I think I would be definitely doing a disservice to women if all I did treat was just the pelvic floor. No matter what, it's all a kinetic chain, is what I say. And I think that not only can women benefit from pelvic floor therapy, but I think that you kind of have to treat the woman as a whole, because during pregnancy, like Kerrie mentioned, there are so many changes that are happening postural wise, pelvic floor wise, and back, hips, SI joint, all of it. So as far as all of that stuff goes, you can definitely find, at least with a treatment from me, that there's going to be some form of all of that being taken into account.
And I know some problems like hip pain, back pain, they can actually be referred pain, meaning that that pain isn't actually coming from the back of the hip, but it may be coming from pelvic floor or I'm assuming some other areas as well. How would somebody after they've had a baby know when that pain is coming from something else? So let's say I have hip pain. How do I know that, stretching isn't going to get rid of it and it's actually coming from something else and I'm really working on the victim and not the culprit?
Right. Well, the easiest answer is definitely going to be coming in to get a checkup, some type of pelvic floor therapist, of course, because they will not only be able to ask the appropriate questions to kind of dive into, when do you get the pain? Is it during certain activities? Can you point to where it is? Is it sharp? Is it dull? Numbness, tingling, all that kind of stuff. They can do like a background check of that.
Yep.
But then of course doing an external and an internal pelvic exam is going to be really important as well, because like a lot of things in the medical field, stuff can be missed all the time. And I've seen it with patients before, where that they've gone years with thinking that, oh, it's my hip and it must be, a labral tear, or it's just this really tight muscle. And they've gone through all these different practitioners, and no one ever thought to ask them a basic question of, is sex painful? Is inserting a tampon painful? Is there leakage? Like all of these basic questions that come as far as pelvic floor goes that are completely missed. And if someone would have just stopped and asked those simple basic questions, it could pretty much lead you right to pelvic floor therapy. And so that's something that as soon as I kind of hear a red flag from a woman, whether we're, speaking as far as if they're coming in saying, and I am treating them for back pain or hip pain, and all of a sudden I hear them say something where I'm like, wait a minute, that doesn't sound right. That doesn't correlate at all. Let's dive into this a little bit further. And so, very much so, just like any other parts of the body, things can refer pain. But I think ultimately getting to the root cause and asking those questions, which some providers, I think, maybe just get a little bit frazzled to ask, but they're so important, because big things can be missed, and patients go years, doing, regular therapies and all these other practitioners, possibly even MRI surgeries, when really at the end of the day, it could have just been something simple like pelvic floor.
Sure. And I think, I've learned a lot from both of you today. And I think the thing that I've kind of taken from this is, there are personal trainers, and then there's somebody like Kerrie who has really specialized in this kind of discipline, and the same thing for you, Courtney. So the thing I'm learning from both of you is, while maybe a personal trainer can help you with some general fitness, this is beyond general fitness. So really work with somebody who's kind of a specialist of their field, and who can listen for those very simple things. Like that's maybe a simple question that somebody else wouldn't think to ask, can give you, I don't want to be too dramatic, but life-changing results. So, that's really helpful. I think so. A lot of these questions today were asked in our Facebook group, the Fit and Healthy Denver Facebook group, and so I want to ask. There's only one more that I have left that was put in the group, and so you've answered part of the first one, which was, do women really need to settle for having bladder issues after giving birth? Which I think is pretty clear no. as you are both vigorously shaking your heads. So, what should women do to help the pelvic floor? Now, I know the answer from both of you is it depends and it's very individualized, but the answer somebody wants is just give me something to start with, right? So, is there something that is a fail safe? Yeah, maybe it's not the most effective, but it will help a little bit that we can give our listeners.
Yeah, I can. I'm going to jump in here. 100% diaphragmatic breath. That's your number one tool to connect to your pelvic floor, to get it to function properly, and as a great starting point of like, do I even know where my pelvic floor is? I think the reason I got into this field is because I had no idea that I needed to worry about diastasis recti or prolapse or my pelvic floor. I was like, I'm just having a baby. Cool. I can still do push-ups. I can still do this. And I couldn't. And after my first baby, I was dealing with a whole host of issues and like nobody knew how to help me. So diaphragmatic breath is definitely the number one. And then number two is like after you connect that area, feeling it function. So like when you do a hip bridge and you add some weight to it, do you feel pressure downward or do you feel like you have control? Do you feel like you're going to pee or do you feel like you have control? So starting there of like just connecting into it and feeling it for maybe the first time. And then learning how to engage your core in a way that regulates that pressure. That's the number one thing. So my favorite thing are the P's. So if you feel pain, pressure, peeing, or popping, then you need to either back off or reconnect. So those are some things that you can think about, like while you're moving, while you're running, while you're doing squats, when you pick up your kid, when you lift groceries out of your car, like everyday movements, check in with those P's and see where you're at.
Great.
Yeah, don't just keep doing 100 crunches every day, ladies. No matter what TV or anybody else tells you. You've got to make sure, like Kerrie said, that you are engaging the core appropriately, not just trying to brace and suck in and take all your breath away and just do a bunch of crunches. You're only going to end up doing more harm than good.
Yeah, I could talk about that for another 2 hours. Like, don't ever do crunches again.
Yeah, never. It's awful.
And Kerrie, you touched on it, but kind of the other big one that I know of is after pregnancy, diastasis recti, or some people are going to call it mummy tummy. And I know crunches with that is kind of a no-no, especially depending on how big it is. But maybe is the focus, is it similar to what you're working with, kind of where you're building the canister? Is it different? What needs to change in order to work on that?
So diastasis or diastasis recti is the stretching of the tissue between your six-pack abs. 100% of women experience it by the end of their pregnancy because your belly has to stretch. But the difference is that it's either injury-based or it's normal. So if you injure that tissue in a way that prevents it from coming back together, we'll say within 12 weeks postpartum, then you know you have some work to do. And regulating that pressure within your abdomen is the best way to heal it. So if you're constantly putting that pressure outward, then it's never going to get the chance to heal. But at the same time, you need to challenge it enough to teach it to turn back on. So it's a lot harder to train tissue than it is to train muscle, but it does want to come back together. And the best way to do that, again, is starting with that diaphragmatic breath. If your breath is functional and the mechanics of it are working properly within that canister, then you're going to help mitigate the dysregulation of that pressure outward against that tissue. And when you do crunches, if you think about what's happening to that canister, like think of a Coke can and then you try to bend it in half. Like, where'd that pressure go? No, we're good. So we don't want to do that. The best way to heal diastasis is to regulate that pressure. So like starting in a bear plank when you're on hands and knees, so you have a lot of support. Can you hover your knees off the ground without feeling that pressure outward or downward? Then can you progress to an elevated plank? Things like that. So you still want to challenge it, but you don't want to beat it up. And it all comes back to breath, 100%. I know it's so boring. Like, I breathe every day, but if you're not breathing right, then you're not doing anything good for your body. So.
Right. Okay. Courtney, anything to add on that? I think she did a great job explaining it, but anything else you want to add?
Yeah, no, I think I have one last question for you, Kerrie, because you gave birth during this quarantine. So, as far as kind of what we're going through right now, with COVID and everything, do you think that there's a new set of challenges for women who are pregnant or have just given birth or are about to give birth because they're going to be at home more, going back to work possibly, still at home, postural wise, things like that?
Yeah, 100%. So, first thing, my 6 week checkup was virtual. So, it kind of fell on my shoulders to communicate like, do I have a diastasis right now? Am I feeling pressure on my pelvic floor? Because mostly it's focused on postpartum depression rather than like your physical body at that point. So you really have to advocate for yourself right now. And like, if you feel like you need to be seen in person and you're comfortable with it, then you got to push for it. And then just being an advocate for yourself in general, like seek out a pelvic floor physical therapist because your OBGYN is not going to tell you about it. 85% of the time, they're not going to tell you about it. So you have to seek that out yourself. And then another challenge is, yeah, we're home, we're sitting a lot, and now you're also feeding a baby, whether you're breastfeeding or bottle feeding, you're sitting with your shoulders probably rounded forward more than you're used to, and you're also sitting a lot. So your glutes are all of a sudden turned off, your pelvic floor is taking a beating from you sitting, a lot of downward pressure, and you're crunched forward in that canister now, so that pressure is all going down and out in a way that it shouldn't. So just, being mindful of your posture, activating those back muscles, stretching your chest, um, things like that are going to be hugely beneficial to you if you cannot get into a pelvic floor PT or to your doctor, if that's something, that you're not comfortable with doing in person yet. Hop on a Zoom call. We're all here for that. I do Zoom sessions, and I'm sure Courtney would too, just to see where you're at, see what you look like with your body. And yeah, just my best advice is to advocate for yourself because no one's going to do it for you.
All right. So I've got one last question for us. So you both work with ladies during pregnancy, postpartum, and we didn't talk about this, but Kerrie, I know you also work with ladies in pain. Courtney, you work with ladies in pain as well. How would somebody, let's say after pregnancy, know when to see Kerrie, and how would they know when to go see Courtney? So how
All
would
right.
they make that decision? In other words.
So I would say that that mummy tummy look where you're like, hey, I still look like I'm 3 or 4 months pregnant and I'm 6 months postpartum. Oh boy, sorry.
No
Hold
problem.
on. I'm getting a phone call on my computer.
It happened to me while ago too.
um, so that mommy tummy, that distended belly look, that's a sign that your core is not healing properly. Leaking too, like bladder leakage. And then if you're still in pain to the fact where you're like, you can't be on your feet for a long period of time, or it's not comfortable to go for a walk, you're having pubic bone pain, SI joint pain, your hips are popping, you're hearing noises left and right. That's a sign that like you're not necessarily healing in the way that you could optimally be healing. So outside help is what you should be seeking. And then also just treating it as self-care. Like you're a new mom,
Hmm.
all the focus is on your baby. When's the last time somebody asked you how you were doing? Like take that time for you and seek out the help that you need, and it's going to feel good. It's going to feel like the best time or money you've spent on yourself in a long time. So like, again, comes back to advocating. And if you're in pain, you don't have to be. So any level of pain past that 6 week mark, seek help.
Gotcha. Courtney?
Yeah, and I think too, just as long as everything checks off okay, I don't think that there's any issue at all with seeing someone like myself or Kerrie at the same time too, and working together. I love being able to do like co-treats, I guess, if you will. I think it's going to be more beneficial for the patient. I learn more, Kerrie can learn more. We can kind of be in tune with everything. So yeah, as long as the woman's not experiencing, a crazy amount of pain, or she's at least able to, fire her pelvic floor muscles, fire her diaphragm, then yeah, you could definitely seek treatments like both of ours at the same time as well.
Okay, great.
Two
All
birds with
right.
one stone.
All right, so let's wrap up because I want to be respectful of both your times. Let's put out some socials out there so people can follow you. And so let's start, Courtney. Where can people contact you?
So people can find me both on Facebook and Instagram. So we're Kinetic Chain Denver, but it's spelled Kinetik Chain Denver. And we've got blogs on our website as well, kineticchaindenver.com. Anything from leakage, bladder stuff, diastasis recti, pelvic floor pain, all that good stuff. You can go and check it out.
And Courtney, you are very soon putting free reports on the website for leakage, for mummy tummy, for pelvic pain as well that people can download for free on little simple things they can do to help themselves.
Correct. Those are just getting finished up right now. Yep.
Great.
They're a couple pages long, but they've got tips and tricks on them. So that's something that you can check out as well.
Perfect. And Kerrie, where can people find you?
I am on Instagram, kerrieaudie.fit. Same, email me, kerrieaudie.fit@gmail.com. And you can find me at Pearl Street Fitness in Wash Park all the time. I pretty much live here. Um, and I do sessions out of here. I also do virtual sessions. And my main focus is like, it's not about getting your body back. It's about feeling good in your body again, regaining strength, maintaining strength, stuff like that. So like that mommy tummy doesn't have to be part of your life. You might not look the way that you looked before you got pregnant, but you're going to feel stronger.
Great. So if anybody would like to get more fit, get rid of pain, and get either a six pack after pregnancy like Kerrie, or just get back to normal, regular life so that you can more fully enjoy it, spend time with your kids, look these two ladies up. I'm sure they'd be able to help. All right. Bye, everybody.
Bye.